Hey guys, Steve here just blew my mind about female hair loss. So, Steve, tell me what you just told me.
So for hair loss in general, there's two major subsets of genetic pattern hair loss. There's a female pattern and there's a male pattern. What's interesting is that obviously a female pattern applies most to females, but there are women that can have a male pattern. There's also men that can have a female pattern. Now, the females that have a male pattern, for the most part, are good candidates for hair surgery. The men that have a female pattern, for the most part, are not good candidates for hair surgery.
Wow. So, male pattern hair loss is like the horseshoe kind of look, right?
Right. It's receding in the front. Mm-hmm. So when women recede in the front, that's how we get a good indication that it's mainly a male pattern. Okay. And then the crown or the bald spot in the back, if they don't jump on preventative treatments, that's how a male pattern starts.
Okay. And a female pattern is?
So a female pattern for either men or a woman is a diffuse thinning everywhere.
Okay.
That's
even the donor area.
Everywhere.
Okay.
Everywhere. Yes. That's very concerning. The good news is they respond very well to the preventative treatments.
The men?
Either one.
Either
when
one.
you have a female pattern, you respond very well to the preventative treatments. So the good news is you may not need anything except preventative treatments that can restore it at least to a point where you're no longer having loss and you have thicker hair.
But the bad news is that if you have female pattern hair loss, whether you're a man or a female, then you are probably not a good hair transplant candidate.
That is correct.
Okay. So, Steve, what should a female do when it comes to hair loss when they're experiencing either female pattern hair loss or male pattern hair loss? Let's take it first with female. A female experiencing female pattern hair loss.
Okay.
Diffuse thinning. What should they do?
So most females that come and see a specialist have already gone to a dermatologist. Dermatologists spend 16 seconds with you. They tell you to use Rogaine and they send you out the door. That's not a nice experience. I've always said this, male hair loss is really bad. Female hair loss sucks. Nobody cares. So when you talk to a specialist that really does care, that wants to help people, there's about 4 things, kind of a checklist you can go through. For this video, very quickly, I'll hit them. The first one is just go get some blood work. When you go to your GP or your gynecologist, you need to make sure you get a panel screen for your thyroid and your iron. Now, sometimes when your gynecologist reads your iron level, there's a range of like 15 to 105. You're 26. Okay, no problem with your iron. That's a problem. We need it to be up around 90 or 95. So the number one reason outside of genetic hair loss for women that can cause hair loss is low iron.
Interesting.
So that's something that without spending any money, without buying anything, you can just have your blood drawn and we can do a screen, or you can have a screen done, talk to a specialist and have them diagnose your blood work and give you some good advice. So that's number one. Number two is kind of the easy way to get started with something that's pretty inexpensive, very successful, compelling, and easy to use. I call it the medicinal approach, medicinal therapy. Now, David, you're using the combination therapy of the 98% pure finasteride. You're using the biotin and a minoxidil 5 milligrams all in one pill, which is amazingly effective and easy to use and very cheap. Women that are either post-childbearing years or for some reason, biologically cannot have children can use the same medication and it's very effective. However, many women that we see are in childbearing years and that becomes a big issue. So we take the finasteride out of the equation and we get them set up with an oral minoxidil pill. We do about 2.5 milligrams and we add biotin to it and it is phenomenal. Everybody that I know that's female that has any hair loss issues, just personal friends, neighbors, people at the gym, they're all using it. They're all really successful with it, okay? So that's number 2. Number 3 is laser. Laser therapy works. Now, you've done videos before on laser. I'm a huge fan of laser. I think that the most important part of laser is you have to use it.
Yeah.
You have to make sure you're compliant. And, you can see David's videos for opportunities and what would be the best for you to purchase in regards to laser products. But you want to make sure you get something that's built well, that's not going to fall apart, that has some sort of a warranty on it, and it's easy to use. It kind of doesn't look stupid on your head, so you hate wearing it.
Consistency is really key when it comes to using a laser helmet. a lot of guys ask me, which laser helmet is best, this one, that one, and they mention all of the different amounts of lasers in each one and every combination. The one that I personally use is the iRestore Pro, and it's a combination LED and lasers. But guys will ask me directly, what's better? Like, I've got this Capillus, I've got this laser Hair Max or whatever, and I'm not a laser expert enough to be able to tell you that this one, because it's got an extra 20 lasers, is going to do anything more or better or worse for you. But the most important thing with all of these is to use them consistently, because all of them are going to be beneficial in some way, in some level. Maybe it varies by 10%. But what's going to vary incredibly is the difference in their effectiveness if you don't use them religiously. Because just like taking a pill, if you're supposed to take a pill every day and you only take it once every 3 days, how can you really expect to get the results from it? Or antibiotics, that's one of the biggest problems with antibiotics is people give you the antibiotic pill and you take it the first 2 days and your throat starts to feel better, and then you forget to take half the rest of the pills, and then everything gets worse. So consistency is really key.
Yeah, the next treatment for women and options in regards to hair loss is the injectable therapies. So there's different injectable therapies out there. One of the issues I have with injectable therapies is every dermatologist, every med spa, every cosmetic surgeon, every plastic surgeon wants to get a piece of the pie. So everybody's doing these injectable therapies. It's just not that easy. So once again, like we tell our male patients, you need to see a hair loss specialist that can help you. Now, the two types of procedures that are most popular right now within the specialists is ACell PRP injectable therapy, where we take a little blood out of your arm, put it in a centrifuge, and spin it down and take the plasma out. The plasma doesn't do anything more than deliver the ACell, which is a biomatrix stem cell component that's used in burn units and orthopedic surgeries and whatnot for tissue regeneration. We've got to get that powder form ACell into the scalp. The only way to do that is plasma. So what a lot of these places do is they just do the plasma with no ACell. That makes no sense. So avoid the PRP every few months, and that doesn't work. So you're looking at ACell PRP, and then the newest technology, which I'm all excited about, is the exosomes. Exosomes are, from a science standpoint, are amazing. They're, these doctors out there, specialists in the industry, are injecting 100 billion with a B, the exosomes into your scalp. The exosomes are direct communicators with the RNA in your scalp. Now, this has been working through the coalition of independent, hair surgeons, the top guys in the country that have been sharing this technology, and already there's what I call the doctors out there that want to monetize this. So be very careful. You got to make sure it's pure. You got to make sure it's the right product. You got to make sure it's not diluted. So, when we walk into these clinics, we're very vulnerable. We're very emotional, especially women. Trust me, it's horrible that women lose their hair at any age. So you're looking at the blood work, you're looking at medicinal, you're looking at the injectable therapies, and then at last resort are the women that do have an actual male pattern, and they have very good quality hair in the back of their head. They are the ones that are the candidates for hair transplant procedures. But like the male patients, there's nobody's a candidate for a hair procedure until we stop the hair loss. A hair transplant does not stop hair loss. So what we need to do is figure out one of these other therapeutic options to get you in a situation where you've put out the forest fire, you've stopped the bleeding. Now your hair's in good shape. Now there's no more hair loss and you need the front area filled in a little bit. Now you're a great candidate if you qualify for a hair transplant.